My name is Joe Trunzo. I'm a clinical psychologist. I've been in practice here in Rhode Island since, I guess, about 2002. I got my license. And since then, I've been providing treatment for folks with a variety of different disorders, but mostly anxiety disorders. I see a good portion of folks that I see have OCD, and I also do some work with health and chronic illness. So in addition to my private practice, I have a faculty position in the psychology department at Bryant University, which is where I am right now. I'm in my office at on campus. Don't tell my bosses. I gave a talk similar to this a couple of years ago. Matt Evans and I talked about cognitive behavioral therapy and ACT therapy, and how they're more sort of like complementary as opposed to contradictory approaches. So everybody knows about CBT. CBT has been around for a very long time. I was kind of born and raised in the CBT model. So a lot of the work that I did with in psychotherapy was very CBT based until, I don't know, probably about 10 plus years ago, I started to learn about the ACT approach, and then specifically in regards to its use in folks who are suffering from OCD and anxiety, and then how to do exposure work from an ACT framework as opposed to a CBT framework. So this talk is going to be kind of all about, I'm leaving out the CBT part because Matt's not here with me tonight. And I want to keep this a little bit simpler. So I'm pretty much, you may have heard about ACT. Compared to CBT, it's a much newer approach to psychotherapy, but it's actually been around for quite a long time, but it's just starting to sort of get some legs in the mainstream. So I've been working in this therapeutic model for almost a decade now, if not more. And I actually almost work exclusively from this model. I don't do a whole lot of traditional CBT work anymore. So I'm just going to talk about ACT. I'm going to kind of explain, what the model is, how it works in relation to exposure therapy, and how it can be helpful in helping people who are dealing with some OCD symptoms, or really, any other sorts of disorders. Okay, so let's see if this one, there we go. So just a couple of basics. So the acronym is ACT. ACT stands for Acceptance and Commitment Therapy, which, we'll kind of go through and outline that in a little bit. A lot of people call it ACT. It's not ACT. It's pronounced ACT. There's kind of an interesting reason for that, which we'll get to in a little bit. But overall, the primary goal of ACT is to increase what we refer to as the construct of psychological flexibility. So the fancy definition there is on the screen. That's the ability to contact the present moment more fully as a conscious human being, and to change or persist in behavior when doing so serves valued ends. So blah, blah, blah. That's a lot of academic speak. The simple way to put that is, if you're psychologically flexible, you're basically open to experiencing what you're experiencing and not letting difficult or uncomfortable feelings or emotions or sensations dictate your behavior. We let our values, what's meaningful and important to us, that serves the valued ends part, guide our behavior. The opposite of psychological flexibility is what we refer to as experiential avoidance. So in experiential avoidance, you're engaging in attempts to avoid thoughts, feelings, memories, physical sensations, or other internal experiences that you find uncomfortable, even when doing so creates harm in the long run. So a fundamental tenet of ACT is that we actually end up causing ourselves more harm by trying to avoid the things that are difficult and uncomfortable for us than if we just remained open to them and allowed ourselves to experience them and move through them in the first place. So, the classic example of this is, somebody's got a lot of depression or anxiety. So to numb that or to avoid it, experiential avoidance, they start drinking alcohol or using drugs, and then they end up developing a drug and alcohol problem, which just compounds the depression and the anxiety and makes things a whole lot worse. And the applicability to this in OCD is obvious. He has an intrusive thought, their anxiety increases, the compulsive behavior is designed as a way to escape or avoid that anxiety. But if all we do is engage in compulsive behaviors to not be anxious, then that basically takes over our entire lives, or at least significant portions of it, that decreases our ability to function and do what's actually really meaningful and important to us. So maybe somebody's cleaning instead of spending time with their kids, or working on school project, or something that they need to do for their job. So that's we're shooting for psychological flexibility. That's the overarching construct that we're going for. And there are a couple of different processes that we engage in to try to facilitate that. And we're going to get into those in a second, but I just want to talk about some of the kind of the ACT basics. So when you look at CBT protocols, a lot of CBT, they focus, they're kind of diagnostic specific. So you see CBT for trauma, CBT for OCD, CBT for depression, CBT for anxiety. And it's not that that doesn't exist in the ACT world, but at its core, ACT's approach is to address human suffering. So it doesn't really matter what form that suffering is taking, whether it's anxiety or depression or whatever. ACT is designed to really be kind of transdiagnostic and present someone, no matter what they're suffering from, with the tools that they can use to be more functional and to have a better life. Broadly, ACT asks people to be open, present, and engaged. Again, I'm going to get into those in a little bit more. There's a pretty heavy use of metaphors, some of which I might touch on tonight. It's a very experiential approach, so much like CBT and exposure therapy, it's very hands-on. So it's not that there's not talking, but it's not the kind of therapy where somebody comes in and they tell you about your day, and you sort of say, oh, I feel, I wish you had a better day, I feel badly for you, and then off they go. ACT is very, very engaging. You're either engaging with stuff in session, or you're being asked to do a lot of homework that's very engaging. It also encourages psychological flexibility in the therapist as well. So believe it or not, therapists can sometimes get, very rigid in their thinking. We can be kind of like a dog on a bone. And a lot of times when our clients are presenting with really significant emotional discomfort, and we feel the pain that someone is experiencing in the room, and we might act in a way to try to avoid that pain because it's uncomfortable for us. But we're not doing you much good if that's what we're doing, because A, we're not modeling healthy processes, and B, it's not going to help you to get to where you want to go if we're engaging in experiential avoidance with you. So overall, there are 6 core processes that ACT encourages people to engage in to move them away from experiential avoidance and towards psychological flexibility. So I'm going to run through those processes pretty quickly to give you an idea of sort of like what they mean and what they are, keeping in mind that I'm condensing what's probably a couple of months worth of therapy into 15 or 20 minutes. So we're getting, it's pretty basic here, but that's okay. So the first core process of ACT is something known as diffusion. So it's important. It's not diffuse, like diffuse is to spread out. Diffuse is to separate from, right? So this isn't, in some ways, pretty similar to CBT. So cognitive behavioral therapy asks you to be really aware of what your thought processes are, because you got to document them, you got to do the thought records and all that kind of stuff. And that's great, because that process in and of itself will help you to kind of recognize and latch on to those automatic thoughts that just keep going and going and going, sometimes without us even realizing it. So diffusion is all about noticing your thought processes and moving from what we call the thinking mind, which is being fused with your thoughts. So in other words, when we're fused with our thoughts pretty much equal reality, right? So I'm scared, therefore this is a scary place, or this is a scary situation. I'm anxious, therefore there is something to be anxious about, whatever it might be. If we think it or we feel it, then we're fused with it. It becomes our reality. Diffusion is all about, putting yourself in a more observing space about what your thought processes are. So rather than saying, I'm scared, right, which is a thought that you're having about a feeling, you can say, so I notice that I'm thinking, or that I'm having the thought that I'm scared, or I'm having the thought that I'm scared. That's very different. It seems very subtle and insignificant, but it's actually a really powerful distinction, because when you can just get that little bit of separation, rather than I'm scared versus I'm having the thought, or I notice I'm having the thought that I'm scared, that separation creates just a little bit more room for you to make better decisions about what that thought is in your life at that particular moment in time. So the whole idea here, and this is where we sort of break off a little bit from CBT, but the whole idea here is that in diffusion, we're really stopping all efforts to control, stop, manipulate, reduce, increase, or alter thoughts. Because when you do that, it just facilitates you being stuck, right? So you can notice that it's happening, but a fundamental principle of ACT is that we really can't control what we think, and we really can't control what we feel. So when we engage in efforts to stop that, we end up kind of chasing our tail. If I ask you to think of a white elephant, or if I ask you to not think of a white elephant, the first thing that's going to pop into your mind is a white elephant. The very act of trying not to think something requires that you think about that thing. So diffusion is about not getting yourself stuck in that cycle, and just kind of recognizing that the thought is there and letting it be there, but to not necessarily have your behavior dictated by what that thought is. So the idea is, if you can diffuse, you can make choices about the thoughts that you can intend to engage with based on functionality, right? So not all, you can have the same thought in different contexts, and in one context it might be perfectly appropriate, in another context it might not be. So if I'm walking down a dark alley at 2 o'clock in the morning in an unfamiliar city, and I'm scared, and I'm saying to myself, I'm nervous, in that context, it's actually really good for me to pay attention to that thought and to act accordingly, because my safety might be at risk. But I'm sitting here in my office at the university. I just heard somebody walk by outside. My door is closed, and I might have the thought that, what if that person has COVID and now I'm infected, or I could get infected. That's a thought I would probably want to try to diffuse or separate from, and make better decisions about, instead of running off campus as quickly as I can. So where CBT will sometimes ask you to kind of argue with the thought, and most of the thoughts that CBT asks you to argue with, they're irrational, so they're probably good to argue with. ACT doesn't really care about labeling it as rational or irrational, real or unreal, true or not true. All ACT really cares about is how functional it is. So the question is paying attention to this thought at this point in time, does that serve me towards my valued end? And we'll talk about valued ends in a little bit, but that's really what we're kind of looking for. So this is just kind of a cute little saying that I think emphasizes the idea behind diffusion. So just for today, my thoughts I'll see as something separate from me. So there's that separation or that diffusion, and I'll not be content caught. So you're not focusing on the content. I am the thinker, not the thought. So I'm thinking it, but that doesn't mean that the thought is me or my reality. So I have no idea who Corinne Shield is, but I like that quote to identify the process of diffusion. So again, no pressure, Julie, but if you have questions, just chime in. I have no idea if I'm going too fast or too slow, but if something pops up, then
No, it's excellent. Thank you.
okay, awesome, great. So yeah, feel free to interrupt me if as I'm going along. I'll just keep going, and if I don't hear from you, I'll assume everything's okay. So second core process of ACT, so diffusion and acceptance. I said that ACT encourages people to be open, present, and committed. So diffusion and acceptance fall on the open side of the equation. So this one gets a little bit tricky because most people, when they hear the word acceptance, they think, well, you're just supposed to suck it up. You're just supposed to tolerate it. You're not supposed to, it's sort of like pull yourself up by your bootstraps and move along. And that's really not what acceptance from an ACT perspective is. So acceptance isn't tolerance. This is sort of the feelings side of diffusion. So in the same way that we don't want to try to escape, extinguish, avoid, or control our thought processes because we don't have any control over them, it's the same thing as feelings, right? We're human beings. Human beings experience a wide range of emotions. And the idea behind acceptance is that it's okay for us to experience that wide range of emotions. And sometimes that's really, really joyful, but other times it's really, really painful. And the idea is that it's two sides of the same coin. And if you cut one part off, so in other words, if you try to avoid feeling pain, then it's going to cost you on the joy side. The idea here is that any good feeling, any enjoyable or meaningful feeling that's worth having, probably also carries with it some feeling that is really uncomfortable. So I'm a parent. I love my children, obviously. I hope it's obvious to them, but I also worry about them. So the worry is distressing. That's problematic. The only way I'm going to be able to get rid of, the only real way I'm going to be able to get rid of my worry about my children is to not have my children anymore. But if I want to experience the joy of raising my kids and having them in my life, I have to accept that part of that is going to be difficult and uncomfortable for me. So that's really what acceptance is all about. It's the idea that whatever side of the emotional coin you're on, you have to recognize that there's a flip side to that emotional coin. And we need both sides, and we have to experience the full range of emotions in order to really be human beings. And it's okay to be anxious. It's okay to be sad. It's okay to be depressed. The trick is, do those emotions get on top of us, and do they stop us from being able to be functional in our lives? And the idea behind acceptance is that the thing that really stops us is trying, all the effort that we put into trying not to feel these certain things actually is more disruptive to our life than feeling those certain things. I'll be honest, this one's hard. Conceptually, it's hard to understand. And what I experience when I work on this with clients is a lot of times, like I have people come in and tell me they have anxiety disorders, and they're like, I want you to help me to not be anxious anymore. And, I kind of have to tell them, I'm like, I'm not going to do that. First of all, I can't do that. And if I do, and then I say, what kinds of things have you been doing to not be anxious? Well, I don't leave the house, or I drink, or I smoke weed, or I distract myself, or I shop, or, I'm like, well, if I'm engaging in things to help you avoid anxiety, we're just doing more of the same things that you've been doing that really haven't been effective. My job is to teach people how to be more functional while they are anxious, and to develop the ability to be more comfortable with being uncomfortable, because we're human beings, and human beings are going to be uncomfortable. There's no such thing as a fully comfortable human existence. It's just not how life works. So a lot of this is taken from Eastern philosophies, Buddhist thinkers. This is not a new concept, but the incorporation of it into Western psychotherapy approaches is relatively new. So this last point here that I have on this slide, this drives me nuts. So culturally, we are bombarded with messages that if you're not happy, something's wrong. And that just couldn't be further from the truth. I would say that if you are happy all the time, something is wrong. Human emotions are transient; they fluctuate all the time, and that's normal. Efforts to control them just tend to cause a lot more difficulty. This is a cartoon. Everybody expects me to be happy, which only makes things worse. It kind of piggybacks on what I was just talking about. So everybody has this expectation, that you should be, that you should feel certain ways, and the reality is that we feel how we feel. We just have to focus on how functional we can be while we're having the various emotions that we have. So again, it's about ceasing those efforts to control the emotional experience, because that tends to be futile and that leads to experiential avoidance, which tends to keep us pretty stuck. And I recognize, particularly when I'm working with people early on, this whole acceptance thing can be a really tough ask, because when people come to me, they're in a lot of pain and they're really hurting. But if you can get someone to wrap their head around it, it's actually a very, very powerful insight. And this idea that ACT tries to teach people how to feel differently, so how to experience your emotions in a different way, not change your emotions by feeling differently. And that's not easy, but when it's really counterintuitive to how our culture operates, but when it clicks, the impact of that tends to be really, really significant. It's one of the coolest things that happen when I do therapy with folks. So the third process is something called self as context. So this is essentially diffusion from non-workable ideas of ourself. So we have a tendency to carry previous versions of ourself around with us, right? So we all know that things that happened to us when we were a kid, how we were parented or how we were raised, or formative experiences in childhood, they stay with us. And a lot of what happens to us now, we interpret or receive through the lens of who we were when we were 8, 9, 10, 20, 25, whatever. And the idea behind self as context is you want to be viewing yourself from what your current life experience is. And while those past versions of yourself and those past perspectives can be informative, they're not determinative. So the idea here is to be here now, not there then, right? So what we don't want is self as content, right? So if we have ideas about ourselves, which is like, I'm no good, or I'm stupid, or I'm overweight, or I'm ugly, or I'm worthless, those are self as content thoughts or versions or ideas of ourselves. We want to see ourselves through self as context. So what's happening in my life right now? This person is treating me well, and maybe that's because they like me, or maybe that's because I did something that pleased them. So we want to try to be looking at what's happening in our life through the current version of who we are, not sort of carrying all the baggage of the old versions of who we are, whether that's trauma, painful childhood memories, whatever. So it's easy. The first step is to entirely change who you are, and it's not what we're looking to do. So the fourth process is what's called contact with the present moment. This is essentially mindfulness. So that's the buzzword that most people are familiar with when we're talking about this. So all this is an open, non-judgmental contact with the present experience of your life, no matter how difficult, uncomfortable, painful, joyous, exhilarating, or devastating that feeling might be. So anxiety lives in the future, right? Anxiety is all about what could happen or what might happen. So the more you are able to stay present in the now, the less fuel you give anxiety to thrive. It becomes kind of like a fish out of water. So if you're paying attention, we'll notice that we're often thinking about what might happen in the future, or regretting what might have happened in the past, and then we're missing what's happening right in front of us. So mindfulness or contact with the present moment is a skill that we work on in ACT to help people to stay grounded. We use a lot of sensory exercises, basic mindfulness exercises. And when you're able to be more present, then it helps you to be more attentive to diffusion and acceptance and the other processes that that we're working through and that we're dealing with. So this is it's a pretty important one. I'll be honest, I'm not good at this myself. I have a really hard time with this, and this cartoon kind of sums it up for me. So all we really have in life is this moment. No, wait, this moment. Actually, this moment. Well, really, it's this moment. And the thing with mindfulness is you just have to treat it as an almost constant process. So your mind is going to hook you and you're going to go in all different kinds of places. And your job is really just to kind of notice that that's happening and then just keep continually bringing yourself back to the moment. And it's really, I mean, it's a skill. It's not talent. All of this stuff are things that that you can work on and that you can get better at through practice. And you don't have to, that doesn't mean you have to shave your head and move to a Zen Buddhist monastery and meditate for 40 years. You can do all this in the context of your day-to-day existence. And that's really what ACT treatment is all about, is figuring out how to do it that way. So number 5, right? So now we're moving into the kind of the action side. So what I get a lot of times is when I say to people, you really don't want your behavior to be overly dictated by attempts to control what you're thinking or what you're feeling. So then people will ask me, well, if I'm not supposed to behave according to those things, how the hell do I figure out what I'm supposed to do? And this is the answer to that question. So ACT is a very, what we would call value-based approach. And what our values are, these are the kind of the ever-present anchors and guideposts for making decisions in our lives. And we have different values for different domains in our life: work, leisure, relationships, spirituality, whatever. The good news is, for as much as I've told you about how you don't have control over a lot of things, right? You don't have control over what you think. You can't control the thoughts that pop into your head. You don't have control over what you feel, because you're a human being. Your feelings are going to change. And I've just talked about how hard it is to have self as context and to be in contact with the present moment. Values, you have total control over. You get to choose your values. Nobody can dictate these for you. You get to decide what is meaningful and important to you. The important thing to remember about values is they are not goals. Goals are attainable, right? So an example of the difference, so I might have a value of being as healthy as I can be, right? So keeping myself in good physical health. That's a value, right? I'm never done doing that. I never get to a point where I say, I am in good physical health, and then I just stop doing the things that I do. A goal that might be in line with that value is, well, maybe I want to lose 10 pounds. That's a goal. And once I lose 10 pounds, that thing is over, that's done. A value is always present. So it's not something that you ever fully achieve, but there are these anchors or guideposts that you use to guide decisions in your life. So, and I'll use the dad example again. So I had a goal of having children, right? That was a relatively easy process to find someone who was willing to have them with me. God bless my wife. But my value is to be the best father that I can be to my children. And there will never be a point where I'm done with that. And that value is really a guiding force in almost everything that I do in my life. It's a value as to, I have 2 daughters. So it's a value as to how I treat my wife, how I behave as a father, how my kids see how I work and what I do, how I conduct myself with other people. Everything, almost everything that I do in my life, that's in the back or sometimes the front of my mind. That value in guiding my decisions about what I do with my life is there. So an important part of this is that we have to recognize that when we are moving in a valued direction, sometimes that is really painful and very difficult, right? So to stick with his dad example, when my kids were little, occasionally I had to punch them, I had to discipline them, which was excruciating for me. I hated doing it, but I knew that I needed to do it because I have to turn my kids into responsible human beings and not raging spoiled brats. So as painful and difficult as it was for me to administer those consequences for their unacceptable behavior, I embraced that pain towards a valued end. And because I knew that that pain had some purpose to it, that it was connected to a value, then it made it easier for me to endure and accept and be open to experiencing that pain. If I chose to avoid it, well, like I'll let it go this time, but I won't do it. Well, then the problem just gets bigger and bigger. So experiential avoidance leads to bigger problems. Acceptance of discomfort in service of a valued end leads to a more meaningful existence, both for me and for my kids. This is the difference between pain and suffering. Pain is unavoidable in life. We're going to have it. But if it's pain with a purpose, if the pain that you're experiencing is connected to some kind of value, so if it's really painful to go out into the world because you're afraid that something terrible is going to happen because that's what your OCD tells you, but you go out and you do it anyway in exposure work because that's connected to the value of you being a more functional human being, then that's pain, not suffering. When you try to avoid or control pain through experiential avoidance, that's when it becomes suffering because it's not connected to any valued end. All you're doing is trying not to feel something or not to be something. And that's excruciatingly difficult to do. I would argue that as human beings, it's almost impossible. And it leads to just a lot of dysfunction in our lives. So last process, and then we'll kind of talk about some of the exposure stuff and we'll get into there. So the last process is called committed action. And this is why we call it ACT. Instead of ACT, it's ACT as in do something. At its core, ACT is rooted. It is a very, very hardcore behavioral therapy. It's actually rooted in radical behaviorism. So it is a very action behaviorally oriented process. And the idea here is that, again, you have control over this. Hard to control what you think, hard to control what you feel. We can control what we do. And the idea here is that if you figure out what your values are and you anchor your behavior in moving you toward those values, although it might be painful, although it might be uncomfortable, and you might not be able to make that pain and discomfort go away, but you will move through it. And on the other side of it, you actually end up having a more meaningful and a more vital existence because you haven't spent all this time kind of chasing your tail, trying not to feel a particular way. I sort of refer to this as Nike therapy. It's like, just do it. Being engaged, right? So open, present, and engaged is a very, very important piece of this therapy. So this is a fancy drawing. This is what we call the Hexaflex. So as you can see, psychological flexibility is right in the middle there. Oh, my light went off. Apologies. So this is the open side. This is the present side. This is the engaged side. These are all of the 6 processes. As you can see, they all lead to psychological flexibility, but they are also all connected to one another, right? So in therapy work, if I'm trying to get someone to a little bit of movement on acceptance, but they're pretty stuck, then I might come over and start talking about values to get them a little bit more flexible to move in that direction. Okay, so we can kind of move around this pretty skillfully to get people to become more psychologically flexible overall. That's kind of what we're shooting for. So really, I don't have to talk about this too much. but I think that you can see the applicability of ACT in OCD work. A lot of people think that exposure and response prevention is a kind of exclusive domain to cognitive behavioral therapy. Exposure and response prevention is a therapeutic technique. It can be approached from a variety of different theoretical frameworks. So while CBT and ACT are both rooted in behavioral theory, there are some differences in how one would conduct exposure work from an ACT perspective as opposed to a CBT perspective. Ultimately, it doesn't really matter. We know that ERP is really effective in treating and helping people who have OCD. So there's some minor philosophical differences. And sometimes the CBT folks and the ACT folks get into a little bit of territorial battle about this kind of stuff, but I tend not to think about it that way. They're both really valuable ways to approach exposure and response prevention. So, ACT and ERP, we might expose a person to a trigger. We would engage in response prevention. The difference is we're not so much focused on symptom reduction. I'm not really, look, if someone's anxiety goes down, great, but it's not necessarily a goal of mine. It's rather helping someone to increase their level of comfort with sitting with that anxiety and being present with it, rather than trying to make it go away, right? And look, a lot of CBT approaches, they're not really interested in extinguishing either. So again, there's sort of, fine shades of difference here, but ACT is making we're seeing it more and more. Actually, the OCD program at McLean Hospital in Boston, which is a world famous psychiatric facility, they actually take pretty much an exclusively ACT-based approach to their work with their clients and their patients. So behavior needs to be value driven, not focused on controlling, escaping, avoiding, or extinguishing unwanted emotions. That's the gist. That's pretty much that's my story, and I'm sticking to it, as they say. So what happened there? Can you guys see me?
Yep.
Oh, there we go. Okay, I just had some. There we go. Okay, so I just had some screen things. So that's all I have to say, Julie. I'm happy to answer any questions that you might have. If you don't, that's okay too. I'm just really thankful to Ryan and OCDRI to give me the opportunity to talk about some of this stuff.